Tonight, a recent report by the South Carolina Hospital Association says violent behavior towards healthcare workers is on the rise in the state of South Carolina, no exception. Here's Shelley Garzone.
Before a lot of the awareness around workplace violence had arisen, a lot of our care team members generally considered it part of the job.
Danielle Schurer is the Chief Body Officer at MUSC Health. She says the conversation about violence against healthcare workers is one that often goes unnoticed.
We believe that we're getting more reports that we're not necessarily seeing more violent events, but people's threshold for tolerating it has gone down.
According to the South Carolina Hospital Association, healthcare workers are 5 times as likely to sustain workplace violence injuries than any other profession.
While we did see that the emergency department was the most frequent place where incidents occurred, we also are seeing trends up on patient floors, which is kind of surprising. So you would normally think that the emergency department is kind of a chaotic environment.
Laura Hewitt is the Vice President of Workforce and Member Engagement with the South Carolina Hospital Association.
We're doing a lot of work with hospitals trying to figure out what things work, whether it's from some kind of new technology or new training for certain staff or other pieces of equipment like weapon detection systems or anything like that. We're trying to figure out what things are they using that are pretty effective, and we're sharing that learning across the state as well.
According to the data in the study, nurses accounted for 47.7% of workplace violence in 2023, with incidents most commonly occurring in patient rooms and bathrooms.
We do a lot of drills now to make sure that our response teams are responding in a timely fashion. So we measure the turnaround time, we debrief on all those drills to make sure that that everyone knows what their role is and that our response times are very fast.
De-escalation trainings, duress buttons in clinical areas, and flagging violent patients are some of the many things the Medical University Hospital is doing to keep their staff safe.
We created a whole signage campaign and a communications campaign that can be used internally for your own staff, but it can be used externally towards your patients and visitors that basically says, we're here to help you, we're not here to harm you. So signage, I think, is a part of it, and setting expectations for patients and visitors up front that, we're here to help you, and we don't tolerate any of these types of behaviors towards our staff or any aggression towards staff.
It is very real. It is not unique to MUSC or South Carolina. I'm just grateful that it's a part of the part of the conversation now. It didn't used to be really even discussed within healthcare, much less outside of healthcare. And it really, like I said, it really takes a village to control what we can control and keep our team members safe.
Shelley Garzone, News 19 WLTX.